going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting a little bit about tennis elbow, commonly referred to as lateral epicondylitis and more recently known as lateral epicondylation. So, tennis elbow. Let's chat a little bit about the anatomy first before we delve into some things to look for and what you can do about it. So, we basically have a bunch of muscles on our forearm, on the top of our forearm, called our extensors. So, they're responsible for cocking your wrist back like this. They attach to a common area called your lateral epicondyle, which is this bony bump just on the outside of our elbow. And basically, those muscles are responsible for extension of our wrist, and when this movement is done for a prolonged period of time, so repetitive strain injury or too much too soon, if you overload those tendons that attach to that area, you can get tennis elbow. And it's known as tennis elbow because of the backhand. When you're playing tennis, you're doing a lot of wrist extension. So what happens here? So any sort of tendinopathy, so it used to be called tendinitis or lateral epicondylitis. So the itis means an inflammatory response, but now, more and more research is looking at it and seeing that it's not actually an itis. There's no inflammation. It's more of degenerative changes. It's a tendinopathy. So they turn to lateral epicondylation. So a bunch of these extensor muscles, they attach or they originate here on the outside of the elbow, and they attach to various parts of your hand. So how do you tell if you have a tennis elbow? Usually there's going to be pain kind of in that area around where the tendons are, which are close to that attachment where the elbow is on the top of your forearm. In addition, we can do some tests where we basically assess the strength, or we look to see if we can provoke the symptoms with resisted wrist extension. So I ask you to hold your wrist in this position. I push down and you have to hold that. That's activating those wrist extensor muscles, and that usually provokes a little bit of pain. If you want to tease out to get some of the specific muscles, you can resist, or what we do is we resist different fingers. So the ECRB, or the extensor carpi radialis brevis, attaches to the base of the third metacarpal, which is right around your hand. So if I get someone to push down into my finger with their fingers, so I'm pushing down my finger and they're trying to push up to go finger extension, because a lot of those muscles that extend the wrist, they also extend your fingers as well, then that provokes pain. If you want to get the ECRL, which is the extensor carpi radialis longus, you ask them to resist wrist or finger extension. So I'm pushing down and they're trying to push up. That's going to activate that muscle as well. So those usually can provoke some pain. In addition, it's going to be tender in that area. That's how we assess it also, and based on the mechanism of injury when people come in. The other thing to note about tennis elbow is it doesn't really get better with time, because it's an overuse injury, and if you're continuously doing what you need to be doing, it's not going to get better. You need to work on the rehab. You need to work on some activity modifications and things you can do to kind of take some of that load off of that tendon, and not only allow it to heal, but also allow or perform the appropriate exercise to help it get stronger. Because the issue with this is there's not a lot of blood flow to those tendons, so they're not going to heal just with rest, and it usually can get worse over a prolonged period of time. There's a lot of exercise and different modalities that you can do to help with the symptoms. One of them is just an isometric, so basically just trying to strengthen these muscles here. Even though you're using them a lot throughout the day, you're not actually specifically strengthening them, you're just using them. So isometric wrist extension is going to be the first one. So I'd usually get people to push into their own hand and just kind of meet their resistance to try to activate those muscles. Hold for 5 to 10 seconds, and you're pushing at 50-60% of your maximum. We don't really know why isometrics help. They do have an analgesic effect or a pain relief effect. We don't know why, but it does work. It's just the important thing is making sure you're tailoring it based on how irritable it is. And the nice thing about it is you can push as hard or as little as you can based on how irritable it is. So obviously you start a little bit lower and then you progress as you get stronger. The other exercise is just resisted wrist extension. So I just grab a weight and I can rest my wrist on something supportive. For the purposes of this video, I'm just having it in the air, and support it with my hand, and I'm just working on cocking my wrist back, trying to work on some of that strength. Very simple, just trying to get those muscles firing or moving a little bit. The other thing that you can do are something called frictions. So basically, if you put your middle finger over your index finger and you find that muscle or where it's a little sore, you rub perpendicular to how the muscle runs. And the purpose of this is you're just trying to get a little bit more blood flow to that area. It does help with some of the symptoms, and it does feel a little bit better what I find when I do this in the clinic. The other thing that you can do is a tape job. I use Leuco tape and Hypofix. So this Hypofix is the first layer that basically just goes around that area that's sore. First layer, the tape is really doesn't have a lot of give. It's very strong. So putting it on bare skin can be quite irritable. So that's why I use this Hypofix ahead of it. So basically put this over, and then I loop this around, and I apply what's called a radial glide, where basically I'm pulling the skin and I'm trying to change where the muscles that are attaching to the lateral epicondyle, I'm trying to change where the forces are distributed, because they're all going to that common area. By using this tape job, it helps to just take off some of the pressure in layman's terms off that area, and provides pretty quick symptomatic relief. The other thing that you can use is a tennis elbow brace. They sell them on Amazon for $40 to $50, and that a lot of people wear that, and it does provide some good relief if you don't want to have a tape job. The tennis elbow brace definitely helps. You just have to make sure that you're putting it in the appropriate spot, which is usually a few centimeters below that elbow joint in that area where all those muscles attach. Hope you learned a thing or two about tennis elbow. We chatted a little bit about the anatomy, why it happens, what can be done about it, some of the exercises and some of the different modalities. Hopefully you can give those a go. Obviously this is a medical advice, so if it is bothering you, the best thing would be to go see a physiotherapist in your community who can help with the symptoms, but definitely something that can be pretty debilitating and annoying if not taken care of, because it doesn't have a tendency to get better on its own. Let me know what you thought. Leave a comment down below. Tell me about your tennis elbow story, or if you've ever had tennis elbow and how you were able to help get it better. Until then, we'll see you in the next video. Thanks for watching.